Hi, I'm Pallavi Prasad, and this is my weekly vaccine bulletin. Just the news, no noise. In the last week, the government has put out a bunch of vaccination related guidelines. Here's what we know so far. In phase 1, 30 crore Indians will be vaccinated. These include healthcare workers and frontline workers. State governments have sent names to the central government, which has collated a priority list. Then, people above 50 years of age. These will be identified using the latest electoral rules for the Lok Sabha and Legislative Assembly elections. And then, people below 50 who have comorbidities. This health data already exists with the government. These are the priority groups. Once they are inoculated, the rest of the population can get the vaccine based on how the disease is spreading and the availability of the vaccine. This is important. If you do not belong to these priority groups and you want to get a COVID-19 vaccine, you have to compulsorily register yourself on the government's upcoming COVID app, COVID Vaccine Intelligence Network. There will be no on-the-spot registration counters at vaccination sites. CoWIN, it's a digital platform the Health Ministry is building to monitor vaccination efforts in real time. The app is yet to launch, but when it does, you can download it from App Store or Google Play. It has 5 modules, one of which is the registration module. It's where you self-register with basic details like your name, date of birth, permanent and current address, and details of comorbidities, if any. Then you have to provide a photo ID proof for verification. 12 are valid, including your Aadhaar card, your Manrega job card, bank passbook, and passport. Once registration is done, the Beneficiary acknowledgement module of the app kicks in and sends an SMS to the registered mobile with a date and a time for getting vaccinated. Who assigns this slot? Healthcare workers who will plan vaccination sessions and who are using the administrative module of CoWIN. Surveyors at the local level will also conduct a survey of the health and comorbidity condition of anyone who registers. This data will be uploaded on the CoWIN app to help health authorities decide who gets the priority while assigning vaccination slots. Sessions will be held every day from 9 a.m. to 5 p.m. One session can have 100 to 200 people depending on capacity. And each session will have a vaccination team of 5 people only. Once you receive the vaccine, you have to wait for 30 minutes at an adverse event following immunization center, AEFI. These will be designated local healthcare centers or hospitals. All AEFIs will be linked to vaccination sites through the CoWIN app. Here, trained healthcare workers will monitor and manage any side effects that may occur after getting the shot. A QR-based vaccination certificate will be given once you are done. And the report module of CoWIN will prepare reports on all vaccination sessions so that there is data at all levels for surveillance and follow-up. This is the basic structure of how vaccination will take place in India against COVID-19. Before I go, I have a newsworthy vaccine update for you as well. A healthcare worker in Alaska who received Pfizer's vaccine had a severe allergic reaction that kept coming back despite treatment. She is now okay and has been discharged from the hospital, but doctors came very close to shifting her to the ICU. She had no medical history of any kind of allergy, and Pfizer says that it is working with local health authorities to assess the reaction, but vaccination will continue. That's me for today. Once again, my name is Pallavi Prasad and this is Newsworthy. If you found value in this video, do share it with your friends and loved ones. And don't forget to follow or subscribe to our feed wherever you're seeing this.